Hello everyone. So the current session is about ninth cranial nerve, and these are the subheadings: introduction, functional component nuclei, course and relation, branches and distribution, applied anatomy, and clinical testing of the ninth cranial nerve. So ninth cranial nerve is glossopharyngeal nerve. It is a mixed nerve composed of both motor and sensory fibers, but predominantly it is sensory. It derives its name from the fact that it provides sensory innervation to tongue and pharynx. Okay, you can see here the glossopharyngeal nerve. What are the functional component? It is having spatial, visceral, efferent component, that is arising from nucleus ambiguous. Spatial, visceral, efferent, that means which is the nerve of the third pharyngeal arch. It supply the muscle arising from the third pharyngeal arch, which is stylopharyngeus. Also, it has general, visceral, efferent fiber. That means it is providing parasympathetic secretomotor fibers to the parotid gland, and nucleus is inferior salivatory nucleus present in the medulla. Then there is spatial, visceral, afferent fibers. The fibers terminate in nucleus tractus salutatorius, which carry the taste sensation from the posterior 1/3 of the tongue, including valid papilla. Then there is general, visceral, afferent fiber, which terminate in dorsal nucleus of vagus. They carry the general sensation of pain, touch, and temperature from mucous membrane of pharynx, tonsil, soft palate, and posterior 1/3 of tongue. And there are general somatic afferent fiber which terminate in nucleus of spinal tract of fifth nerve, carry proprioceptive sensation from stylopharyngeus and skin of auricle. So there are 5 functional components related to the ninth cranial nerve. So you can see here nucleus tractus salutatorius, dorsal nucleus of vagus, inferior salivatory nucleus, nucleus ambiguous, and spinal tract of trigeminal nerve. Okay, so spinal tract of the trigeminal nerve having general somatic afferent fiber, nucleus tractus salutatorius, that is spatial, visceral, afferent, that is for taste. There is dorsal nucleus of vagus, those are general, visceral, afferent fibers. Then there is from inferior salivatory nucleus, those are coming from the general, visceral, efferent column, supplying the preganglionic parasympathetic fibers to OT ganglion, which in turn supply the parotid gland. And then there is nucleus ambiguous, those are the spatial, visceral, efferent fiber supplying the muscle arising from the third pharyngeal arch, that is stylopharyngeus. Course and relation. So the ninth cranial nerve arises from the upper part of the lateral aspect of the medulla here. Okay, so it arises from the lateral part of the medulla, and here this one is the ninth cranial nerve arises from the upper part of the lateral aspect of the medulla. This one is ninth cranial nerve between olive and inferior cerebral peduncle by 3 to 4 rootlet. These rootlet unite to form a single trunk which leave cranial cavity by passing through intermediate compartment of jugular foramina enclosed in a separate sheath of dura mater. There are superior and inferior sensory ganglia located on the nerve as it passes through the jugular foramina. So you can see here through the jugular foramina it is going out along with the 10th and 11th cranial nerve. So the smaller superior ganglion lies within the jugular foramina, and larger inferior ganglion lies below the jugular foramina here, and which contain cell bodies of most of the sensory fibers of the nerve. After emerging from the jugular foramina at the base of the skull, nerve passes downward and forward between internal jugular vein and internal carotid tree. Okay, so here is the glossopharyngeal nerve, ninth cranial nerve. When it is descending anterior to the internal carotid artery to styloid process, and muscles attached to it to reach the lower border of stylopharyngeus here and passes along the stylopharyngeus through gap between the superior and middle constrictor of the pharynx. So here is the glossopharyngeal nerve, ninth cranial nerve. Okay, it is curving along the lateral aspect of stylopharyngeus muscle and then passes deep to the stylohyoid ligament and posterior edge of the hyoglossus muscle, and it is breaking into terminal branches which supply mucous membrane of posterior 1/3 of the tongue, then pharynx and tonsil. Distribution. So there is tympanic branch which is arising from the inferior ganglion, which is going to form the tympanic plexus, and from the tympanic plexus there is lesser petrosal nerve which will be going to the otic ganglion, and postganglionic fiber will be reaching to the parotid gland. Then there is carotid nerve or the nerve of herring. Then there is pharyngeal branch, there is branch to the stylopharyngeus, there are tonsillar branches and lingual branches. So the tympanic branch or Jacobson nerve, okay, you can see here this is tympanic branch. It is leaving the inferior ganglion and entering the middle ear through the tympanic calculus, situated at the bony edge between the jugular foramen and the carotid canal. It forms tympanic plexus over the promontory of the middle ear. Tympanic plexus gives lesser petrosal nerve which is carrying preganglionic parasympathetic fibers which relay in the otic ganglion, and postganglionic fibers will reach to the parotid gland. Also it gives twigs to the tympanic cavity, auditory tube and the mastoid ear cells. Then there is carotid nerve. Carotid nerve, also known as nerve of herring, which is the branch to the carotid sinus and the carotid body. It serves as an afferent limb for the presoreceptor and chemoreceptor reflex from the carotid sinus and the carotid body to regulate heart rate and respiration respectively. Then there is pharyngeal branch, which join the pharyngeal branch of the vagus and cervical sympathetic chain to form the pharyngeal plexus on middle constrictor of the pharynx. Okay, so here is the middle constrictor and this is the pharyngeal branch. Then there is branch to stylopharyngeus. It arises as a nerve wind around the stylopharyngeus muscle. It is only motor branch of the glossopharyngeal nerve. So here is the stylopharyngeus muscle which is supplied by the branch from the glossopharyngeal nerve. Then there are tonsillar branches which are going to supply the mucous membrane of tonsil, fauces and palate. Here you can see the palate, tonsil and the here tongue also. Lingual branches, that is those are supplying the tongue, supply posterior 1/3 of the tongue and velvet papilla, and they carry the taste and general sensation. Applied anatomy, the lesion of the glossopharyngeal nerve is rare in isolation. They are associated with involvement of vagus nerve. So complete lesion of glossopharyngeal nerve result in loss of taste and general sensation over posterior 1/3 of the tongue, difficulty in swallowing, loss of salivation from parotid gland and unilateral loss of gag reflex. There is something known as glossopharyngeal neuralgia which is very rare. It is characterized by paroxysmal attack of intractable pain in area of sensitive distribution of glossopharyngeal nerve, that is throat, tongue and ear, precipitated by swallowing. Clinical testing of glossopharyngeal nerve. So first is gag reflex on tickling posterior wall of pharynx, soft palate or tonsillar fossa. There is a reflex contraction of pharyngeal muscle causing gagging and retching. So this is gag reflex. Testing sensation in posterior 1/3 of tongue, that is also clinical testing of 9th cranial nerve. These are the references and thank you.